This is One on One. Welcome to an ongoing series that we're doing called Autism, A Different Way of Thinking. We are honored and pleased to be joined by Cornelia Gilpin, who is a nurse manager at Overlook Medical Center. That's part of the Atlantic Health System. Good to see you.
Good to be here. Thank you for having me.
Let me fully disclose out of the box that Atlantic is one of our very generous underwriters in public broadcasting, particularly to our production company. Let me ask you, this series on autism, we keep saying a different way of thinking. How do you think about it and deal with it every day?
So I think this, the program that we have at Overlook Medical Center, working with Project Search, provides
Go back, Project Search, let's clarify that. What is that?
So Project Search is an organization that's actually national. They're in 48 states in 7 countries. And what they do is facilitate a transition for students who are almost done high school or between 18 to 21 who have disabilities, and it helps them to develop job skills so that they can transition to the work environment and the workforce.
Break down some of those job skills for us, if you could.
Certainly. So some of the things that they can learn depending on the student, and it really is customized and tailored to the student, are repeatable tasks. So say, for example, we have the variety of programs that we have the students work with are in human resources, and so they can be responsible for filing, clerical work, environmental services, where they work with our staff to collect garbage, dispose of waste. We have them working in our library, in our environmental services department. They've also worked in our foundation.
So let me stop you right there. Folks you're talking about can do a lot. Mm-hmm. A lot.
Yes.
To what degree is there a misconception, misperception of people with autism that you're talking about in terms of what they're capable of, on the part of many?
And I think this is where I am so pleased about the program that Project Search is and when it was developed and what it's all about, because there is a lot of misinformation about the capabilities of individuals with disabilities.
Such as?
So it's like, well, what can they do? How do I interact with them? What if they're not able to speak, or what can they really do? And so I think it's not even so much intentional, but more of a lack of knowledge. They don't really know what someone can do. And I think where this project, where this program is helpful is that it allows employers to realize what these individuals with disabilities can do.
Sorry for interrupting. How do you actually engage, have conversations with prospective employers of people dealing with autism?
So one of the things that we do at Overlook Medical Center with Project Search is we have like a job fair. We call it speed dating for the students, where they actually get the opportunity to meet with other organizations that come in who are potential employers. So closer towards the end of the program, they've been provided the opportunity, they've been taught with the instructor in class, and they've had some real life experience in interning in different departments. They are now able to present themselves to an employer.
How do you coach them? I mean, I spend a lot of my time coaching people in another life and their communication skills. I'm curious, is it different to coach, to train, to help a 16-year-old, a 21-year-old, 22-year-old to prepare for communicating in such a pressure-filled job interview?
Absolutely.
Is it different?
I think it is. I think the difference is, depending on the individual, the time that you spend with them, you get to understand what their strengths are, what comes naturally for them. If they're hesitant or shy, how to become more confident, how to be able to articulate clearly what their strengths are. And so when they're going through the various internships, you really are providing feedback. Both the department that's working with them and their instructor provides feedback to them to say, you did a really good job with this. This is really great. Here's how you could do this a little bit differently. So that's how they're coached. So by the time they get to that job fair speed dating, they're a little bit more comfortable, they're more confident, they can share what their strengths are, what they have done. They can give examples of the things that they've actually done in the various internships.
How rewarding is this for you? You're a nurse manager.
Yes.
You got into, it's not a business because you're not making a ton of money.
Absolutely.
But it is an industry. And most of the nurses, we work with the Nurses Association and others in your profession. I'm always struck by the degree of empathy, compassion, the desire to actually make a personal difference with people. How much of this is personal for you?
I got into this because I enjoy working with people, and I feel that everybody deserves an opportunity to show what they can do. And one of my departments was one of the areas that we had students come in, and we met with the instructors, and we talked about what we envisioned them to accomplish. And so in various levels, for me, seeing the students start the program, when they come with their parents, a little bit hesitant about what this is really going to be about, and then seeing them at the end when they're graduating, when they're fully integrated into the program, and also seeing them after they've completed the program.
How rewarding?
Extremely rewarding.
How rewarding for them and their families?
I think extremely rewarding for them as well. We actually have one example of a student who was hired at Overlook. We actually had 4...
at your place, at Overlook?
At our organization. In one situation, he did so well. The nurses were so appreciative of what he had done and how it relieved them of taking care of some other responsibilities so they could spend more time with their patients, that the organization actually created a job description for a job position for this student that we didn't have before.
What does it do for the families?
I think it helps them to feel like their child will also be a valuable member of society, contributing to society, and not necessarily, it provides them more independence. So the families feel like my child is not going to feel different. And that sometimes is where it's challenging for them. It's like, what will my child be able to do? And how will they be able to gain independence? And I think this program provides that.
Those are daunting questions before I let you go. You are, in fact, joining us for a roundtable panel with 10 experts, including, again, I've said this in previous interviews, with the Commissioner of Health, Dr. Elna Hall will be joining us. It's a top priority for the Department of Health in the state. It's a national problem. It's maybe even more of an issue in New Jersey because of the numbers, but I'm going to ask you this. What's the most significant message you want to get across in the panel discussion? What is it?
I think one thing I would like I think it's twofold. So for parents, there are opportunities for your child to grow and expand and be confident, productive member of the workforce. For employers, I would say don't open up your mind to the possibilities. It's not just necessarily what can we do for them, but what can they do for us.
Be open-minded.
Be open-minded, absolutely.
Consider the possibilities. Maybe that has something, it's interesting. Again, I repeat, autism, a different way of thinking. That's a different way of thinking. And I want to thank you, not just for thinking that way, but more importantly, doing it every day with your colleagues. Thanks so much.
Thank you so much.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 30 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by the Northward Center, the Healthcare Foundation of New Jersey, PSC&G, TD Bank, MD Advantage Insurance Company of New Jersey, Berkeley College, and by the Fidelco Group. Promotional support provided by NJ.com and AM 970 The Answer. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.